Hey class, in this recording we're going to focus on the adaptive immune response, and I'm just giving an overview of it. So just to review, refresh, the immune system has lots of widely distributed cells in our bodies that regulate and recognize foreign substances. If it's something that's okay to be there, generally we'll leave them alone. But if it's something that doesn't belong in our body or that our immune system recognizes as not belonging in our bodies, then our immune system will try to neutralize or destroy that substance. So for this to work, for our adaptive immune system to work, we need it to be systemic. It needs to be all the way throughout the body. It needs to be specific to the specific pathogen. So it only focuses on that specific substance made by that specific pathogen. And then we need to have some kind of memory so that the subsequent exposures to the pathogen, we are able to respond more efficiently and during the neutralization process. So let's talk about our adaptive immune system. It can be broken up into two broad categories. We have cellular and humoral. And when we think of humoral, I want you to think of blood, B-L-O-O-D, blood-based immunity. When we think of cellular immunity, I want you to think of intracellular immunity. As opposed to blood-based immunity. So when we think of the cellular, cell-mediated immunity, really this is going to focus on intracellular parasites. So if we have diseased host cells, that's where the intracellular parasite is going to be an issue. So in this case, think viruses, virus for that intracellular parasite, or foreign cells. So if we can find a bacterial cell floating around, cell-mediated immunity would be our white blood cells directly attacking and destroying that white blood or that bacterial cell floating around. So it's going to rid the body of pathogens that can hide or reside inside of human cells where they're very difficult and inaccessible to our typical antibody response. The best way to get rid of a pathogen that's residing inside of a human cell is to kill that human cell and just destroy everything. It's kind of a scorched earth policy where once a human cell gets infected by a virus, not only does our body want to destroy the virus, it wants to destroy any of our own cells that are harboring that virus. When we think of humoral immunity, this is immunity that's typically going to be associated with the bloodstream and lots of antibodies. So humoral is an old word for blood. Most of our antibodies were initially isolated from our bloodstream. So humoral immunity depends on those antibodies. And antibodies don't directly destroy a pathogen, but instead they tag it for destruction. It's like having a giant blinking neon sign, come here, kill this, blinking above that bacterial cell. Now, as we look at our antibodies, they can be dissolved into body fluids. You may have previously mentioned or remember that in a previous recording I talked about the 4 humors of the body: bile, blood, urine, and saliva. And of those 4 humors of our bodies, we typically don't bleed patients out anymore, but that when we had the humor-based medicine, we can still see some of that root word terminology within our modern medicine. Now, these antibodies are going to be everywhere in our bodies as long as they're extracellular. They can only work on extracellular targets. The moment that pathogen is hiding inside of one of our cells, we need to shift back to cellular mediated immunity. Now, as we look at this adaptive immune system, we can have natural adaptive immunity. And this is when we make our own antibodies or our own T cells. These T cells are going to be for the cellular side of immunity. Antibodies are going to be on more of the humoral side. So when we produce our own when we make our own cells or proteins for adaptive immunity because we were naturally infected by that pathogen. We also could have artificial active immunity. And I'm a huge fan of artificial active immunity. You get most of the benefits without most of the downsides. When we look at this is when we make our own antibodies, our own T cells, but we weren't naturally exposed to the antigen. Instead, we were given a vaccine. And that vaccine will be made of dead or weakened, attenuated is a technical term for weakened, pathogens. Or sometimes those vaccines are just made of bits and pieces. It's like if you take the pathogens, throw them into a blender and make a 7-layer salad out of the different parts of the pathogens, and then expose your body to that pathogen 7-layer salad, where you can have a surface membrane protein, a surface membrane glycolipid, a intracellular protein, and you can have all these different parts of the pathogen. And if you expose our bodies just to a few parts of the pathogen, usually surface markers, we can develop an immune response to it. So that's our vaccines, also known as artificial active immunity. However, we will need to periodically stimulate our immune memory. We need to periodically give a booster shot to individuals so that their immune memory cells are going to be on high alert. It's kind of like when you're trying to study something and remember something. If you study it once and never study it again, your memory and recollection of it starts to fade. But if you're constantly giving yourself a booster shot or a memory boost by reviewing and refreshing, you can maintain a high level of protection, or in this case, a high level of recollection of that information. Two other forms of our immunity is natural passive immunity. So instead of natural active or artificial active, natural passive immunity is when we have antibodies from somebody else naturally being given to us. This is typically going to be a mother-child phenomenon. So mom can have her antibodies pass through the placental membrane and go into baby while baby is in utero. Or mom can have her antibodies go into her breast milk, and then baby can ingest her antibodies from the breast milk so that baby can have some passive immunity. A common phenomenon, and if you ever talk to mom, I mean, the mommy stories are dime a dozen. I mean, moms love talking about their babies, especially if they are a mother of a single child and it's their only child, like the first child. It's it's very, very good topic of conversation. And a common thread among mothers is they'll oftentimes talk about how their kids get really sick when they stop breastfeeding their kids. And this is just a normal part of life. When moms stop breastfeeding their children, all of a sudden those children don't have all of those antibodies from mom's breast milk, and they get sick very frequently. And in case you're wondering, other stages in life that involve kids getting sick a lot typically involve the kids being exposed to lots of new pathogens. So when the child starts going to daycare or starts going to school, usually the kid will be sick a lot for about 4 or 5 months. We also have artificial passive immunity. And when we look at artificial passive immunity, it's going to involve antibodies being injected into somebody. So instead of that individual breastfeeding or exchanging blood nutrients through a placenta, we instead will take antibodies from the donor, purify them out of that donor's blood serum, and then inject those antibodies into a recipient. And this is how we can treat snake bites, botulism poisoning, rabies, tetanus poisoning. There's a whole host of diseases we can treat by purifying antibodies that target the pathogens of those diseases. That's all we have for this recording. If you have any questions or comments, please feel free to post them in the class discussion board or to shoot me an email. And as always, happy studies.